Hello everyone, today I will be telling you how to carve a permanent maxillary canine. First of all, we will mark all the dimensions of the tooth for the carving. The cervico-incisal length of the crown is 10 mm. Length of the root is 17 mm. Mesiodistal diameter of the crown is 7.5 mm. Mesiodistal diameter of the crown at the cervix is 5.5 mm. Labiolingual diameter of the crown is 8 mm and at the cervix it is 7 mm. So first of all, we'll make the markings for the crown portion and the root. After that, we'll be dividing the wax block into two equal halves from the occlusal surface. Don't forget to mention the surfaces on the base, as I have mentioned it as labial, mesial, distal and lingual surface, which will help you while carving and avoid confusions. Divide the crown length into three halves. That is incisal third, middle third and cervical third. Now take out the wax from the incisal third portion from both the sides. Once you have removed the wax from both labial and lingual side from the incisal portion, now you have to start the carving from the labial surface. Remember that the crown portion of maxillary canine is made up of three lobes: the mesial, distal and the labial middle lobe. Remember that the middle labial lobe shows greater development than the other two lobes. So this will produce a ridge on the labial surface of the crown in the middle portion, because that lobe is more prominent than the other ones. Now we will start with the carving. We will remove the wax from the cervical portion. After we have removed the wax from the cervical portion, now we will carve from the middle third of the tooth to make a smooth surface on the labial side. Carve a little bit to just get an outline and a smooth surface, because we have to carve the middle portion less than the mesial and distal side, because the middle labial lobe is more prominent and there will be a ridge formed in the middle surface of this labial aspect of the tooth. We have to make a cingulum on the lingual aspect. The cingulum of central canine is large, and also there is a lingual ridge present in the center that joins to the cusp tip of the canine, and there are concavities on either side of this ridge. These are called the mesial fossa and the distal lingual fossa. So there are basically two lingual fossas present in the maxillary canine, that is mesial lingual fossa and distal lingual fossa. So now first of all we will carve the cingulum. Now we will carve mesiodistally, and we will make a cusp in the center of the canine. So we will carve this mesially and distally, the extra wax at the edges, incisal edge, and there are two slopes present, that is the mesial slope and the distal slope, and then there is a canine cusp in the center, and the distal slope is greater than the mesial slope, which will help you to differentiate between left and right maxillary canine. So mesiodistal diameter of the crown is 7.5 mm and at the cervix the dimensions are 5.5 mm. Now we will carve the extra wax from mesial and distal side. Now carve the mesial and the distal slope. Remember that the mesial slope is shorter than the distal one, so the cusp will be more mesial. You can see the mesial and the distal slopes. You can appreciate the canine cusp. You can see prominent cingulum. Now all we have to do is carve the ridges and concavities that are present on the labial and lingual side. So we will carve from the mesial and the distal side a little bit to make a shallow concavity or depressions to make the center part look more prominent. Now from the lingual side we have to make two fossas, the mesiolingual fossa and the distal lingual fossa. Now we will do the polishing with the muslin. So the dimensions are perfectly fine. Now we will proceed with the root carving. The length of the root is 17 mm. The root is almost ready. Remember that the root of the maxillary canine is almost conical and tapering towards the apex, and it is distally tilted. Also it has developmental grooves on both distal portion and the mesial portion of the root. So on the distal surface and the mesial surface we will make developmental grooves, but on the distal aspect these developmental depressions are more pronounced than the mesial surface. Now we will do the polishing. So the maxillary canine is ready. You can see the root which tapers toward the apex. The root narrows towards the lingual surface and it has developmental grooves both on the mesial surface of the root and distal surface. On the distal side, the developmental groove is more prominent than the mesial side. Also, you can appreciate the distally tilted root of the canine. So this is maxillary canine from all the aspects: labial aspect, mesial aspect, lingual aspect and the distal aspect.